Welcome to the Ortho Reports podcast. You know, it's wild to think about how a seemingly harmless accident, something that could honestly happen to any of us, can kick off a huge medical mystery. Today, we're diving into a really fascinating case where a minor injury led to a major problem. A dead bone in a construction worker's wrist, and the incredible living patch that ended up saving it.
So can a small injury really cause a bone to just die? We're going to follow the incredible 2-year journey it took to answer that very question for one patient, a journey that really pushed the boundaries of modern microsurgery.
All right, so let's get into the story. Our patient is a 45-year-old guy, works in construction. One day, he has this little accident involving his left hand, and at first it really seems like nothing.
And the cause? Get this. He just struck his palm with his phone. That's literally it. An accident that, let's be honest, could happen to anyone. But this tiny moment of impact triggered a 2-year ordeal of chronic, worsening pain that just would not go away.
And this pain wasn't just sticking around, it was getting worse. Over the course of 2 full years, his condition just went downhill to the point where simple, essential things like gripping a tool became excruciating.
So of course, doctors tried all the usual stuff first. Painkillers? Nope. A wrist splint? Ineffective. They even put him in a full cast for 2 months, but nothing worked. The pain continued and the mystery just got deeper. What in the world was going on inside this man's wrist?
With all the standard approaches failing, the medical team knew they had to dig a lot deeper to figure out what was really happening here.
So the first clue was actually, a total lack of clues. Standard x-rays, which are usually the first thing you do for bone issues, showed a perfectly normal-looking wrist. No fractures, no obvious signs of what was causing all this pain.
But then, they brought out a more powerful tool, an MRI. And that's when the real problem finally came into focus. Deep inside his wrist, one of the small carpal bones, the hamate, was showing this massive internal swelling or edema. This was the source of all the pain.
And that swelling pointed to a pretty shocking diagnosis, avascular necrosis, or AVN. The easiest way to think of it is like a heart attack, but for your bone. A piece of the bone tissue is literally dying because its blood supply had been cut off. And the hamate bone, well, its blood supply is pretty fragile, so it's especially vulnerable to this.
Okay, so with the right diagnosis finally in hand and all the conservative treatments totally exhausted, the team turned to a really complex and frankly elegant surgical solution. The goal wasn't just to manage the pain, it was to bring that dead bone back to life.
The plan was essentially a living bone transplant. Surgeons would take a tiny piece of healthy bone from the patient's forearm. But here's the brilliant part. They would take it with its own artery and veins still attached, its personal life support system. This living patch would then be moved over to the dying hamate to restore blood flow.
The procedure itself was just so precise. First, the surgeons drill into the hamate and clear out all the hardened, dead tissue. Then they transplant that living patch of bone, complete with its blood vessels, and fit it perfectly into place. It's like creating a brand new lifeline to bring that whole area back from the brink.
But the big question, right? After all that incredible surgery, did it actually work? I mean, after a 2-year ordeal, was this patient finally going to get his life back?
Well, the patient's recovery was nothing short of remarkable. Just look at these numbers. His grip strength more than doubled, and his disability score, it plummeted from a rating of severe all the way down to minimal. This wasn't just a small improvement. This was a life-changing transformation.
And get this, not only did his injured hand recover, it actually became stronger than his uninjured dominant hand. I mean, that's how successful this was. A truly fantastic outcome.
The follow-up scans told the exact same incredible story. 5 months later, an MRI showed the bone was alive and healthy again. The signs of AVN were gone, replaced by the signature of healthy living tissue. The graft had worked perfectly.
So this was obviously a huge win for the patient. But why does this one specific case matter to the wider world of medicine?
Because avascular necrosis of this specific bone is exceptionally rare. In all of medical history, only 13 other cases had ever been documented before this one. And that rarity is exactly why every single success story is so critical for surgeons to study and learn from. And when you look at those few other cases, a very clear pattern emerges. Delays in diagnosis are common, and trying non-operative treatments, well, it consistently fails to stop the disease. In contrast, surgical solutions, especially these vascularized grafts like the one used here, have shown the most promising and successful outcomes.
So the key takeaway from the medical report is powerful and clear. It really confirms that this specific living patch technique is a highly effective solution for this rare condition. It provides a proven roadmap for any surgeons who might face this exact problem in the future.
You know, a case like this is a perfect reminder that even after years of horrible pain, a single innovative procedure can completely change a life. It really makes you wonder, what other medical marvels are out there, just waiting for the right diagnosis and the right technique to be solved? Thanks for joining us today on the Ortho Reports podcast.